Hey kids, Dad here. It's Friday, July 10, 2026. It's right about 2:30 in the afternoon right now. Deep breath, Dad. I'm exhausted. It is always something. Always something. So, just a bookend, a fabulous week, which started out on Sunday, right? Sunday night into Monday morning with two residents making a bad decision, having to remove them from the house. This past 24 hours, we've had a resident here who is struggling with some mental health challenges. And I don't want to go into too much more detail, frankly, because we don't really know at the time what exactly is going on. He's not a danger to anybody else, thankfully, although he is behaving very erratically. He's not coherent. He wandered off today, went about 1.5 miles away through the cornfields, got picked up by the sheriffs. So I'm in the middle of my workday here around 11 or so, and I get a phone call and a knock on the door, and it's the sheriffs. And sure enough, this gentleman had a resident had wandered off, and he was having a bit of an episode, and it's not pleasant to witness, to see somebody who is taking a lot of medications for some various mental health challenges, and for them to be struggling. It's tough to see. Obviously you want people to be happy and healthy, but when they start separating from reality in their head, it's tough to see. So we got him down to the hospital. He's currently being evaluated by doctors, thankfully. And I think ultimately what will happen is the doctors will figure out, what's best for him. Whether that's adjusting his medications, whether that's some time with a psychiatrist, we don't know. But I know that we've done everything we can for him, making sure he's safe. Whether or not he comes back here, be it tonight or in the future, will really depend on what's best for him. It may be one of those situations where we're just not able to provide the level of care that he needs, which is to say he may need a full-time nurse, or full-time, doctors within reach of him. And I hope that doesn't come to pass. I hope they are able to figure out what's going on, get him on the right plan so that he can proceed in his journey in a healthy way. But I know that these kinds of things, they're not up to me, right? All we can do as flawed mortal people is our best and make sure that they get the right professional help they need. And I think we did that today. Between the folks here at the house, we have a case manager who works with the residents with their care plans, and he's been quite busy today. So it makes me grateful, I think, for my mental health. The fact that I'm clear-minded, the fact that I don't struggle with debilitating mental illness. Yep, I have anxiety sometimes. I get anxiety sometimes, or my chest tightens up in a knot. That happens sometimes, but that doesn't lead me to wandering off through cornfields by myself, doesn't lead me to erratic behavior. People can't understand me, where I'm talking to people who aren't there. So, prayers for the resident today, kids. Hopefully by the time you ever see this video, if you ever see it, this gentleman, the resident in question, will have gotten the care he needed, be in a safe place. He has a father. He has a daughter. So I'm hoping that he can get healthy for her. If nobody else, right? I'm sure that little girl wants her dad healthy. So it just has me in a bit off today. You know, it's always something, but prayed this morning to God for me to be able to help at least one person. I don't know if I helped this guy at all today, this resident, but I guess I'll go back and hit my knees and pray for another. Hopefully I can help another person today. And if God gives me one more person to help today, then I'll hit my knees a third time and pray for another one. So, hope you kids have a nice Friday. Hope you kids have a wonderful weekend. No idea what Dad's gonna do this weekend. I'm probably going to be as quiet as I can this weekend. Just get some workouts and just sleep. Get some sleep and try and get my mind off some of the stuff going on around the house lately, because it gets exhausting and it gets tiring. And yeah, but get to see you kids in less than a week, about 4 or 5 days on Tuesday. So I'm looking forward to that. Love you kids so much. We'll talk soon.